you love.
Feel good vibes and great music. This is Radio 44. Your music, your life.
Even the other stations are listening.
Well, gotta say this, when it comes to specialized eye care, there's only one name that comes to mind, and that's INU. And today on the show, we do have Dr. Kaushik Solanki. He's a cataract, LASIK, cornea, and keratoconus specialist. So we're going to be talking about a number of things in this. So this is one of the most important interviews that you can think about, because you get to learn so much. I myself am sitting over here thinking, how do I get rid of my glasses? I have no idea how, but I'm sure Dr. Solanki will help me and help you. So keep it right here on Radio 44, your music, your life. Beautiful, beautiful song right there by Vishal Mishra. And I got to tell you, this world is so beautiful. We all think about going to, beautiful locations. We have family members that we constantly want to look at and enjoy, and all that cannot be possible without clear vision. And with INU Hospital, clear vision is a guarantee. And right now we do have a specialist himself and the director, Dr. Kaushik Solanki. First of all, thank you for coming over, sir.
Thank you, Jeet, for inviting me, and good morning to all your listeners.
Good morning from all of us at Radio 44 to you. Now, I think we can establish one straight fact. I've had glasses from, I don't even remember, from childhood. I think I used to play video games a little too much or whatever it was. And I tried wearing lenses, horrible experience, dry eyes and all that. But of course there's LASIK, and your hospital offers LASIK.
Yeah.
So if you could explain to me, what exactly is laser vision correction and how does it work?
Okay, Jeet, now laser vision correction is like, if you look at the eye structure, if you look at the black part of eye, it is covered with a glass-like structure, which is known as cornea. Most of the time, if the cornea is not diseased, it holds its shape throughout the life. So what you do in LASIK is, or in laser vision correction is, you modify the shape of the cornea according to the power of the patient by using a technology, an excimer laser, which is known as a laser vision correction.
Okay.
And there are two types of laser vision correction. One is known as PRK, where it is a surface ablation.
Okay.
And the second is LASIK, where you create a 100 micron thin flap by using a laser or an automated machine, which is known as microkeraton.
Okay.
Then you lift the flap and you expose the eye to the excimer laser, and the computer will consider your power, how to correct and how to reshape your cornea.
Okay.
And once the laser is done, then we put the flap back. It sticks without taking any sutures in 2 minutes time.
Okay.
Okay. And then we shift to the other eye, and the whole procedure takes hardly 15 minutes to get rid of the glasses.
15 minutes?
Yes.
And of course this is pain-free?
Absolutely, yes.
Wow. Okay, yeah.
What we do when we do LASIK, we just put an anesthetic drop in patient's eye.
Right.
And to keep the patient's eye open, we put one speculum. So when you start the procedure, the patient will feel little bit of stretching on the lid for a while.
Okay.
Then patient get used to it. Otherwise there is no pain. The patient will not feel any pain.
But it's 15 minutes, so you don't even have to get used to it too much. Now, who are the perfect candidates for LASIK?
Okay, anybody who is 18 to 40 years of age. I am saying more than 18 because before that the kid is in a developmental phase.
Right.
And the eye, the total shape and size of the eyeball keeps on changing. So normally the person who is having a minus number, like we call myopic,
yes,
the power tend to increase when there is a change in the size of eyeball.
Right.
And in hyperopic, where the patient is wearing plus power, the number decreases with the age.
Okay.
So after 18 years of age, most of the time the number gets stabilized. And when you plan a LASIK, the first and foremost criteria is the person should be more than 18 years of age, plus the power should not change the power should be stable for more than a year. Like the power should be stable before you plan a LASIK surgery.
Right.
And we said before 40 because after 40 patient develop glasses for near, which is called presbyopia. Okay. So even if I correct the patient for a farsightedness, the patient will have a nearsightedness. So the ideal candidate is between 18 to 14 years of age with
18
a
to 40.
40,
Yeah.
stable power,
Right.
no other eye diseases. The retina should be normal, and the patient should have enough corneal thickness to do the procedure.
Okay, and of course with INU, I understand that you go through all these processes. You ensure that you check everything about the patient before you actually proceed.
Absolutely. Actually, as I told you, when we take the patient in OT room to do the procedure, it takes hardly 15 minutes to do the procedure.
Okay.
But when the patient came for a LASIK procedure and when we examined the patient, it took nearly 2.5 hours whether to make out whether I can do the procedure on a patient or not.
Or not. Okay, before we take a small break, got a question over here from Nishma Hiren Shah, who's asking, what about after the age of 40? Is it worth it, or will glasses be needed even if it is reading glasses?
Yeah, after 42 years of age, everybody did get glasses for reading. That is because your lens loses its elasticity.
Okay.
And the person cannot focus.
Okay.
So when you do LASIK, ideally when you do LASIK for both eyes, and you allow patient to do everything without glasses for far, and near patient need to wear the glasses.
Okay.
But in
Perfect.
certain patients, what we do is you can correct patient for distance vision in one eye, and you keep little bit of minus power in the other eye, where the patient distance vision will be little less,
Okay.
but the patient will be able to see for near
Okay.
without glasses.
Without glasses. All right, I hope that has answered your question, Nishma. We are taking a short break, but we'll be back. If you have any questions, send them in 0758 123 444. Taking off the movie Crew, Diljit Dosanjh and Badshah with Naina playing right here on Radio 44. Good morning to you. And we are indeed talking about your eye and, of course, INU Hospital. And we do have Dr. Kaushik Solanki, who's an expert when it comes to cataract, LASIK, cornea and keratoconus, and he's also the director of INU Hospital. So we're still on the topic of LASIK. So I think one of the most important questions that comes to everyone's mind is, number one, how safe is LASIK? And number two, what's the recovery period like?
Okay, now Jeet, if you look at the procedure which can be performed on a body from head to toe, like all the operations, LASIK is one of the most performing procedure in the world, and it is elective procedure. So if it is elective and so many people going for it, that means it has to be very safe, right? It is very predictable surgery. Like before doing a surgery, suppose I am doing a LASIK on you, I exactly know what is the thickness of your cornea and what is the shape of your cornea before the procedure, what will be the thickness of your cornea afterwards, and what will be the shape of your cornea. So it is very predictable and repeatable procedure. The third thing is, once you select the patient, like as I told you, that we screen the patient for 2.5 hours, the surgery takes only 15 minutes.
Yes.
So is there any risk? We come to know before the procedure, and we omit those patients. We don't advise those patients to undergo any laser vision correction.
Excellent.
So it's absolutely safe procedure. And you said about recovery.
Yes.
As I told you, on a day of a procedure, normally we do this procedure in the afternoons.
Okay.
So once the patient, after the procedure, we put a bandage contact lens on patient's eye to make the patient more comfortable. On a day of a procedure, patient may have little bit of redness and soreness in the eye, foreign body sensation.
Right.
So patient go home, sleep, rest. Okay. Once after 2-3 hours, patient become 50 to 60% comfortable.
Okay.
And when you wake up next day morning, it's like wow.
Really?
You can see without glasses.
Oh God.
There is no foreign body sensation. There is no pain. There is nothing. And you can get back to your routine in maximum 48 hours of time.
48 hours of time.
Yes.
Exposure to screens, sunlight.
You can work on your computer. You can start driving.
Okay.
Most of the patient, we call patient that don't drive for 48 hours.
Right.
But most of our patients drive themselves to the hospital on very next day.
Really?
Yeah.
Okay. I think one of the concerns as well. I don't know. This is something that we've heard about. Back in the days, how some people complain about dry eyes. But is that a problem?
Yes, it is. It is a matter of concern. So, like in a screening part, we screen the patient for dry eye also. So, if the patient is having moderate to severe dry eye, then we omit those patients. We don't do laser vision correction on those patients.
Excellent.
So, patient has to have a normal tear film.
Okay.
And when you do a laser vision correction on cornea, it affects the tear film,
Yes.
right?
Yeah.
But that is for 3 to 4 months time, where the regeneration of corneal nerves happens.
Okay.
And those 3 to 4 months time, the patient is on artificial tear substitute
Right.
to reduce the symptoms.
Okay, that's perfect. We will be back shortly after this. Taken off the movie, My Name is Khan. Beautiful, beautiful song by Shafkat Amanat Ali. Tere Naina playing right here on the Morning Mojo. And we have Dr. Kaushik Solanki from INU Hospital. Now, we're looking into a different side right now. I've heard of corneal blindness, but as a layman and someone who's not in your field, I have no idea what it is. So what exactly is corneal blindness?
Jit, like when we started, I told you that cornea is a transparent glass-like tissue
Yes.
on the black part of the eye.
Yeah.
Now, it allows the light to enter into the eye, and it allows the light to focus on the retina,
Okay.
from where you can see clearly. Now, the thing is, when the cornea is not absolutely transparent, when there is any opacity on the cornea, or when there is a issue with the shape of the cornea, like if the shape is not regular, then it doesn't serve its purpose.
Okay.
It doesn't focus the light right on the retina, and then it leads to blindness. And most of the corneal blindness are like treatable blindness. You can do something on the cornea, like corneal transplant or some other laser procedures on the cornea to
Correct
give
it.
patient a better vision.
Okay, so it's basically thinking of a lens of a camera kind of a thing. So it allows the light to come in, and if that is damaged, it's distorted.
Yeah, there are two, like there is a natural lens inside the eye, and the
Right.
cornea is like there are two lenses which try to focus the thing right on the retina. So you
Okay.
can say that is the cornea is an external lens.
Okay, and now if you check the statistics, we actually find that there's a lot of keratoconus in Kenya. So what exactly is keratoconus, and why is it so common in Kenya?
Like I mentioned previously, cornea hold its shape throughout the life. It doesn't change much.
Yeah.
Okay, and cornea is made up of 5 layers, and the central layer, which is a 90% thickness of the cornea, is made up of a collagen fibers.
Okay.
Now, person who is having keratoconus, their collagen fiber, they sleep over each other. They are not linked with each other, and thus the cornea becomes thinner in one particular portion, and it loses its shape. Rather than having a aspheric or
regular,
a round shape,
Yeah.
it becomes conical or pointed cornea,
Okay.
which leads to lot of astigmatism.
Okay.
And the person's quality of vision is very bad in initial phase, and ultimately the quantity also reduces with the progression of the keratoconus.
Is this what, sometimes opticians, I don't know, I'm spitballing over here, they literally say that your eyes, it's shaped like a football, like an American football. It's sort of elongated. Is that what this is?
Not really, because
Okay.
we are not talking about the whole eyeball, whether the eyeball
Yeah.
is elongated or not. We
Yeah.
are talking about the shape of the cornea.
The cornea itself, yeah.
Normally it's a spherical, like it is the surface of one of the, like any circular thing, like let's say football.
Yes.
Okay, but like if your football becomes thinner in one portion, there is a protrusion in that particular part, right?
Right.
So it loses its sphericity,
Okay.
and which reduces the patient's vision drastically.
Okay. All right. We will be back shortly after this. Badshah and Payal Dev with that beautiful, beautiful track. And we're still over here with Dr. Kaushik Solanki, and we are talking about keratoconus. Now, Doctor, why exactly is keratoconus so common in Kenya?
Like there is a genetic and racial predisposition for this disease, particularly in African countries.
Oh, okay.
Like if you look at Caucasian eyes, their cornea is thicker.
Okay.
The brown people, like Asian people, their cornea is thinner than the Caucasian people.
Okay.
And the African people will have the thinnest cornea. So there is a genetic predisposition. That is number one.
Okay.
And the second reason is the weather in this particular country. In Nairobi and in Kenya, there are a lot of patients, particularly young child, develop lot of allergic conjunctivitis, and when they develop allergies in their eye, they rub their eyes a lot.
Right.
And frequent and vigorous rubbing causes chemical changes in a tear film of the eye, and those chemical changes in tear film lead to further thinning of the cornea. So that is the main reason. Like these are the two main reasons. One is genetic predisposition, and second is frequent rubbing of the eye because of allergic conjunctivitis.
Oh my God, I had no idea. As a child, I think I used to rub mine quite a bit. So what are the preventative measures, for keratoconus?
So, like for genetic predisposition, you can't do anything,
Yes.
right? But you can prevent frequent rubbing by treating your allergies. So whenever your child is rubbing his or her eye very frequently or vigorously, you need to go and see a specialist and get it treated as early as possible before it causes permanent damage to the cornea.
My God.
So that is how you can prevent the keratoconus. And the second thing is, if the child is having frequent change in glasses, particularly the cylindrical power, the astigmatic power,
Right.
then you go to a cornea specialist and get some specialized tests like topography of a cornea to find out whether he or she is having a keratoconus, because keratoconus is from grade 1 to grade 5.
Okay.
Now grade 1, 2, 3 is very treatable without doing too much of an intervention.
Excellent.
And if it leads to grade 4 or 5, then you need a more then it goes into like surgical intervention.
Understood. I think one of the most important thing is it's always good to have regular eye checkups so you can at least understand this.
Yes. Anybody who is wearing glasses,
Yeah.
ideally, should get their eyes checked once in a year with a specialist.
Once in a year. Okay, we will be talking about how you can actually get your keratoconus treated right after this. Arijit Singh with that beautiful, beautiful track playing right here, and actually, Dr. Kaushik and I are just talking about keratoconus, and I had no idea, how serious eye rubbing is. Now, can you tell us how exactly keratoconus can be treated?
Now, the initial phase of keratoconus, when it is from grade 1 to grade 3, it can be treated with glasses or contact lenses, where you can improve the patient's vision. But you want to make, as I told you, the keratoconus is a progressive thinning of the cornea. So you want to arrest the disease. That is the primary thing. You cannot reverse whatever damage has been done in the cornea, but if it is very early phase and patient is having a very good vision, what you can do is you can arrest the disease by doing a cross-linking of the collagen fibers, which you call C3R procedure, cross-linking of the collagen fiber. And then you do a rehab by giving glasses or contact lenses to the patient to regain the full vision. Now, if it is very advanced keratoconus like grade 4 or grade 5, then the corneal transplant is the only option. And when you plan a corneal transplant, if the patient's cornea is thin but it is not having a permanent damage like having a corneal scar or anything, that at INDU what we do is we don't do a full thickness corneal transplant, but we remove only the diseased cornea. Like first the external 80% of the cornea has been removed and it is transplanted. Most of these keratoconus patients are young patients and their inner layer is not affected by keratoconus and it is very healthy cornea. So the patient will have a much better vision if you can preserve that 20% inner cornea. So at INDU we do that deep anterior lamellar keratoplasty thing, which is known as a partial thickness corneal transplant. And if keratoconus is very advanced and scarred cornea, then the patient end up having a full thickness corneal transplant.
Excellent. I think it's been really, really eye-opening, this conversation we've had. And once again, thank you so much, Doctor, for your time. And if you have any concerns about your eye, and like Doctor said, at least once a year, it's great for you to go and have a checkup. And you can do that at INU, and they're located on the 3rd floor, Passage Center, Waiakea. You could also give them a call on 0718 202020. Doctor, thank you so much for your time.
Thank you very much, Jeet, for having me here. It's nice talking to your listeners. Thank you.
Yes, and it's so nice to have you over here.